Member for Caribou North.
Thank you very much, Madam Speaker, and I do want to thank the member for her comments today and the recognition that sometimes in government we need to review policies. If things are getting worse, is it an opportunity for us to reflect and advise, and look at that research again? 200,000 more people are without a family doctor since the NDP took office. And so I think it's critically important to reevaluate, are the programs working? Do we have the right mix of programs? Is there more that we can do? And of course, in government, there is always more that we can do. And I think it's also important that we need to recognize that action, of course, needs to occur now so that we can begin to see the shift in the number of doctors in this province. The longer we delay, the longer British Columbians have to wait to receive the urgent care that they need. I want to see our province invest in our talented youth who are eagerly waiting to serve as physicians. Again, I look forward to the announcement that was made during the platform of the SFU Medical School. I think that's a very important program. But in the meantime, there are 13,000 internationally trained doctors in Canada who are not working in their field and available to serve. International medical school graduates have to undergo a number of steps in order to practice in Canada, including a series of national medical exams, completing a residency through a Canadian university, getting certified, and then applying to be licensed provincially. As I mentioned earlier, we are not funding enough residencies for our current graduates, but this is even more challenging for international medical graduates, as less than 10% are set aside for these international students. We are wasting the talent and potential of British Columbians. Instead of serving patients, respected physicians are underemployed at a time when we desperately need more doctors. Over the course of the pandemic, we've been reminded of the importance of having a strong, resilient healthcare system. This doctor shortage is an urgent healthcare crisis, and we must take action now to alleviate the pressure on our doctors. We are very fortunate in the province of British Columbia to have so many dedicated and talented healthcare professionals in this province. And I think let's all of us take a moment in this House to recognize and thank all of them for their many contributions to the people of British Columbia. But we also must do our part. We must reflect on policies and see if there are more things that we can do to ensure that we are supporting an enhancement of physicians, both training and supporting them through residency programs in the province of British Columbia. We must do more to support them so that they can continue to support British Columbians. Again, thank you to all of the amazing healthcare professionals that we have in this glorious province of British Columbia.